So welcome back, doctor. I'll just go and get a bottle of water for us to take a big bite. Just 1 minute, I'll join. So welcome back, everybody. Now, Jefferson's fracture. What is going to be the correct answer? Punctual answer of C1 fracture. Compression fracture of the body of the bony ring of C1 is called Jefferson's fracture. This is the odontoid view, this is called, in which you can see the Jefferson, and there is a displacement of the lateral masses of the vertebrae C1. That's what you can see. So this is another example. कल के एग्जाम में एग्जामिनर आपको ये CT पिक्चर देगा. You should identify the anterior and posterior arches of the C1 vertebra got disrupted. That makes it the Jefferson. So, Jefferson fracture. Then what is Hangman's fracture? It is also called traumatic spondylolisthesis, where there is a bilateral arch. Fracture of the C2. C2 is Hangman. Right? Because you will be going to the God. To the God. C2 is Hangman. Jefferson, you can remember, he is president of America. So that is the reason president is called first citizen. So C1 is Jefferson. It is the hyperextension and axial compression forces, that is windshield, striking to the windshield, is responsible for the Hangman. And FND classification is the one which is basically used. Once more, same FMG ka question. Hangman's fracture, where do we see, doc? We see it in the C2, because you will be seeing the God. You will be seeing to the God after dying. So C2, pars interarticularis fracture is called Hangman. That's the point you should remember. So another favorite question is hyperflexion injury, windshield injury. They're all the ways examiner can ask. Traumatic anterior spondylolisthesis of the axis due to bilateral fracture of the pars interarticularis. What is it called? That is also another way of asking the question. हर बदन आर्थ्रोपैथी कहाँ होता है? Distal interphalangeal. So बोलना नहीं डॉक्टर, हर बदन is distal, bouched is proximal. Right? Bouched is proximal. So now, so what do you see here? Distal. So that is the reason it is the Harbaden's node. Tomorrow's examiner is going to give an image-based question. इसका आंसर बोलो डॉक्टर, you are the champion of champions. What is the muscle in the second compartment of the wrist? Who is going to give me the correct answer? Second compartment of the wrist, purely batti marne wala matter hai. No intelligence required. If you read, you will answer. Come on. Question number 244. Punch, punch, punch. Mohammed Meena is proposing extensor pollicis brevis. Vinusha trying luck with brevis and longus. Prasoon Vaidya also. Absolutely. Excellent. So, doctor, please remember, for the sake of examiner, compartment 1, what do you have? Extensor pollicis brevis, abductor pollicis longus. Compartment 2, extensor carpi radialis brevis, extensor carpi radialis longus. Compartment 3, you are having extensor pollicis longus. Then compartment 4, extensor digitorum and indicis. Compartment 5, extensor digiti minimi. Compartment 6, extensor carpi ulnaris. Compartment 2, compartment याद रखना पड़ेगा डॉक्टर. अगर आपके पीजी सीट का कंपार्टमेंट कहाँ है मालूम होना है आपको. Right now, a patient received an electric shock and fell down. Most of the times, what is the shoulder dislocation? Anterior dislocation. But those who take electroconvulsive therapy, those who have epileptic seizures, they develop the posterior dislocation of the hip, is what you should remember. What is the triple orthodosis mein? What is the triad? So you all know very well. Talonavicular, talocalcaneal, calcareo-cuboid is called triple arthrodesis ka 3 things. Lodge Hansen classification. What is it, doc? Right. Shweta rightly reminds electric bulb and empty glenoid. Correct. So Lodge Hansen classification कहाँ रहता? Ankle fracture में रहता. स्पाइना वेंटोसा स्पाइन में नहीं रहता. कहाँ रहता? स्पाइना वेंटोसा फैलेंजस में रहता. सो कल के एग्जामिनर आपको इमेज बेस्ड क्वेश्चन में ये देता है. यू कैन सी दैट देयर इज अ सिस्टिक एक्सपेंशन ऑफ द proximal phalanx, right, of the index finger, which is called spina ventosa. Spina ventosa is what you should remember. Due to tuberculosis, most common type of lesion in the Pott's spine. Give me the emphatically correct answer, doctor, without missing. A substandard questions hai. Pott's spine, without that there is no question paper, doctor. Pott's spine, I am betting musculoskeletal TB is a age-old favorite area. 1 out of the 10 questions in orthopedics, it is going to see the light. So, Divya is proposing paradiscal. Most of you, absolutely not there. Paradiscal because of the arterial spread. Central type is due to venous spread. Anterior type is due to subperiosteal spread. Appendiceal type means it involves pedicle, laminae, spinous process, transverse process is appendiceal type. So paradiscal is most common. There is a narrowing of the disc space. Narrowing of the disc space is the earliest radiological feature. There is a destruction of subchondral bone. These are the points you should remember. So doctor, these are the classical paradiscal lesions around the disc is what you should be able to recognize. This is another example of a paradiscal lesion. Examiner even can show you one image and expect you to recognize what type of Pott's spine it is. Central lesions. Typically, it is due to the infection, venous in the center of the vertebral body through the Bateson's venous plexus or through the branches of the posterior vertebral artery, you can get central lesions. That will lead to vertebral body to collapse. Collapse of vertebral body is called vertebra plana. कल के एग्जाम में एग्जामिनर पूछेगा आपको एक गर्मा गर्म वर्टिब्रा प्लानर दिखा के भैया ये क्या होता है कहाँ होता है बोल के पूछेगा. It is the central type of TB spine is what you should answer. Anterior lesions, they start behind anterior longitudinal ligament. The pus will be spreading and it is more common. Anterior lesions are more common in the thoracic spine more than the lumbar, right? So this is how typically there is a anterior lesion type of a TB. Then appendiceal means isolated TB of the pedicle and laminae. That is what you should understand. So only the pedicle and laminae get affected, as what you can see. This is an example of the appendicular lesion. Sometimes there can be skipped lesions. यहाँ भी है और यहाँ भी आ गया बीच में एकदम अच्छा है. So this kind of skipped lesions also can occur. So before we go to the next question, one more single liner MCQ for the examiner. Roington's triad that you see in spinal TB. What is the triad include? Primary vertebral lesion, disc space narrowing, paravertebral abscess. The combination of disc space narrowing, paravertebral abscess, primary vertebral lesion को क्या बोलते हैं डॉक्टर? Roington's triad is what you have to basically remember. Then one more important favorite MCQ. Aneurysmal sign of TB spine क्या होता है? Typically the vertebral body will be there, no doctor? So there will be a concave erosion, and that scalloped appearance is called aneurysmal phenomena. Whenever you take the plain radiograph, aneurysmal sign. Then paraspinal abscess will be fusiform in shape is what you should remember. So anterior wedging, gibbous deformity, vertebra plana, all these things should remind you TB. Okay. Now doctor, yes. Which joint is paired in osteoarthritis? Ankle is paired. Dip, pip, knee. Only two arthritis involved dip. What are they? Osteoarthritis, psoriatic arthritis. Most common joint involved in osteoarthritis, knee joint. Pura orthopedicians ka bread and butter. Knee joints only, no? Kienbock. One question on osteochondritis. Without that examiner chodega nahi. Lunate. Then newborn is hypermetropic. How many diopters? 2 to 3 diopters. Plus 2 to plus 3. Highest refractive index. Come on. Easiest, cheapest, biscuitest question. But if you do wrong now, I'll give free coaching. Ekdam free. Come on. Shoot your answer, doctor. 254. Shweta, Rehana, Chauhan. Everybody is saying Corneal. Oh, Chauhan. I'll give you free coaching. Murli Bharadwaj, social responsibility. Hiranmai, free coaching मिलेगा आपको. Doctor, lens, doctor, lens. So, air is 1 doctor, refractive index. Cornea is 1.38, aqueous is 1.33, vitreous 1.34, lens is 1.4. Lens contributes plus 20 diopters, cornea contributes plus 39 diopters of refractive power. Refractive power is greater contribution from cornea. I am not asking that. I'm asking refractive index. वहां कंफ्यूजन होता है, नहीं होना, ठीक है? Now doctor, what is true about persistent hyperplastic posterior vitreous? Typically it is associated with microphthalmia, congenital anomaly due to failure of embryological primary vitreous and hyaloid vasculature to regress. You get PHPV. How does it present? Microphthalmia, cataract, glaucoma. That is the presentation of persistent hyperplastic primary vitreous is what you need to remember. Acute hemorrhagic conjunctivitis, biscuit question. Enterovirus, ऐसे questions अगर हम wrong कर रहे हैं तो we are in amoeba stage of preparation and our competitors are in mammalian stage, right? So out of 953 topics that I gave you, no doctor, as and when as you keep completing the topics with me to do the revision from amoeba, coelenterata, porifera, you will keep evolving and finally become a primate. That is the point you have to look for an evolution. And the entire evolution doesn't take more than 5 months of time, let me tell you. Now, multiple conjunctival hemorrhages, picorna virus is a enterotype 17 is responsible. Klebsiella pneumoniae. Yash Ramanujam is saying, sir, I am in a blue whale stage. Acha, very good. So, Klebsiella pneumoniae, keratitis, it can lead to. So, bacterial keratitis most commonly gram-negative pseudomonas. Klebsiella rarely is a keratitis, especially contact lens wearing guys में Klebsiella is increasing. Dendritic ulcer, typically corneal sensation is decreased in case of dendritic ulcer. So reduced corneal sensation, dendritic ulcer, geographic amoeboid ulcer, when you use incorrectly steroid, that is how herpes simplex keratitis presents. What is the therapeutic indication for corneal transplantation? Once more, therapeutic indications, all kinds of indications for corneal transplant is a favorite area of examiner. Then there is one dirty topics. Have you studied that? Corneal dystrophy. Such an irritating topic. So many अंग्रेजी लोग का नाम याद रखना पड़ता. Very subtle differences. Everything imagination. Still you have to. So keratoplastica, keratoconus is a therapeutic indication. So doctor, what are the optical indications? Reconstructive indications. Reconstructive means to retain the integrity of cornea. Corneal perforation, pellucid marginal degeneration, corneal thinning, corneal melting, post-traumatic loss of cornea, etc. Then what are the optical indications? Fuchs endothelial dystrophy. Then corneal scars, keratoconus, keratoglobus, and corneal degeneration. Yesterday we discussed in the doctor, those who did not attend, please review. Evisceration, enucleation, right? Jarur puchega. Exenteration. Be very sure. Now, without a cravo or CRVO, अगर कल का नीट पेजी है तो मुझे बताओ डॉक्टर. जरूर होता है cravo CRVO. So typically you find in cravo cattle truck appearance. Typically in the cravo, what is a cattle truck part? There is a sludging and segmentation of the blood column in case of the cravo. ये बताओ डॉक्टर, this is the irritating maxima. Most irritating question, doctor, this is, right? If you correctly answer this now, you are that fanatic topper of the tomorrow's exam. Should you answer? Divya is saying 1.5. Amit, Manish, Shweta, Ajay. I know, doctor. Last 1 year से हम सब मिलके रोज एक ही काम है ना, तो भजन की काम, हरि भजन की काम. 1.5 mm is horizontal diameter, 1.8 is vertical diameter, depth is 1 mm, cup disc ratio varies between 0.1 to 0.9 is what you need to remember. What is, अभी बताओ, before going to exam, what is ISNT rule? Inferior neuroretinal rim is broadest, followed by superior, then by nasal, then by temporal. ISNT rule. How is the neuroretinal rim? Favorite question of the examiner. In uveitis, from where do you get keratic precipitates? It is the corneal endothelium. Corneal endothelial cells is what you should remember. So the inflammatory cells on the corneal endothelium form keratic precipitates. You get mutton fat keratic precipitates in granulomatous uveitis. So Koepes iris nodule, Busacca iris nodule, mutton fat keratic precipitate is granulomatous uveitis is what you have to be 100% sure. कितने साल लगेगा टाइप 1 डायबिटीज में रेटिनोपैथी आने के लिए? 1 to 5 years. That is the reason. What is the very important rule, doctor? Whenever nephropathy is there, please check his fundus. Fundus में रेटिनोपैथी रहना है to call nephropathy as diabetic nephropathy. रेटिना में अगर रेटिनोपैथी चेंजेस नहीं है तो in a diabetic individual, the nephropathy that he is having is not due to diabetic nephropathy. That's what you should remember. So there can be retinopathy without nephropathy possible, but nephropathy without retinopathy is not possible in case of diabetes. What is the site of internal hordeolum, doctor? Meibomian gland. So no confusion in tomorrow's exam. Internal hordeolum is staphylococcus of abscess of Meibomian gland. External hordeolum style is a staphylococcus abscess of the lash follicle. Gis gland, mole gland is what you need to remember. Which is a carbonic anhydrase inhibitor in glaucoma. Dorazolamide is the carbonic anhydrase inhibitor. Doctor, still we have a lot of time. Have you studied or at least revised glaucoma drugs? Sure, short एक MCQ आएगा. Glaucoma drugs, examiner छोड़ेगा नहीं. What is the best treatment of amblyopia, doctor? Occlusion. Occlusion. Which eye? Sound eye. Occlusion of the sound eye is the most effective treatment. Now, according to the WHO, best definition of blindness is in the best vision less than 3/60. Once more, one of the favorite questions of the examiner. What is the National Blindness Control Program का definition क्या है? Social blindness क्या है? Right? Similarly, WHO का definition क्या है? 100% you should be sure. Blindness definition is the favorite area in the examiner's question bank. Nikolsky sign, Bulla spread sign. Already we have done a dermatology revision, है ना doctor? 8 hours में last 15 years का FMG का डर्मेटोलॉजी टॉपिक वाइज क्लासिफाई करके रिवीजन कर दिया, उसको निकाला नहीं, यूट्यूब में अवेलेबल है, प्लीज डू रिवीजन. Bulla spread sign, they're all the features of pemphigus vulgaris. What is this golden crusted lesions, doctor? Impetigo, fordyces spots का होता है, lips के ऊपर रहता. They are the sebaceous glands. What is this bug which is bugging you in the NEETPG? Sarcoptes scabiei in case of scabies. इसको क्या कहते हैं? इसको कहते हैं Beckett's nevus. What is Beckett's nevus? Acquired, pigmented, hairy plaque common on the trunk, first and second decade. Typically, it is found on the shoulder, chest, back. It is very verrucous. It has got a hairy growth. No treatment required. Now, lumbar puncture में जब आप चाकू चलाते ना, needle, चाकू नहीं, needle. It will pierce ligamentum flavum. Benzocaine is known to lead to methemoglobinemia. Resuscitation में क्या करते हैं? Early assessment, CPR, defibrillator, advanced life saving. Shortest acting opioid is remifentanil is shortest acting. यहाँ आपको क्या लिख रहे हैं? Morphine sulfate. Where can you use that? Epidural, intravenous, intrathecal, not intradermal. Right? अभी आ गया psychiatry. Anorexia nervosa patient को अम्मा admit हो जाओ बोल के कब बोलते हैं? What are the indications to admit anorexia nervosa? If the body weight is less than 75%, heart rate is less than 45, significant electrolyte abnormality, potassium less than 3, patient's refusal to eat, inability to interrupt binge purge cycle, failure of outpatient are the indications for hospitalization of anorexia nervosa is what you should remember. Copycat suicide. मेरा आंटी सुसाइड किया, मेरा फ्रेंड सुसाइड किया, मेरा रूममेट सुसाइड किया, मैं भी सुसाइड करूंगा, मैं पूरा न्यूज़पेपर में बहुत सुसाइड पढ़ रहा हूं. What is it called? Copycat suicide. It is typically seen in children. Never. Copycat suicides was a phenomenon in 1974. Suddenly the suicide rate started going up because a lot of suicides are written in the newspaper. So people who are young or old, not middle-aged. Middle-aged people know to not just because कोई मर गया तो वो नहीं जाके मरते. मगर old people, oh my friend, all the time we both worked together. That fellow finally shot dead. I should also shoot dead. So children and old people में copycat suicide होता है. A non-diabetic, non-hypertensive, some extra beats. Doctor said they are benign, ECG said they are benign, Turico said they are benign, but he goes from doctor to doctor to doctor. What is this called as? Hypochondriac disorder is what you should remember. So let me see which illness I have. पूरा NEETPG का 19 बुक्स पढ़ने से क्या क्या illnesses हैं देख रहे तो hypochondriasis, right? So hypochondriasis is a somatoform disorder, a fear that I have AIDS, I have cancer, I have heart disease. No physical cause is found, right? Now आजकल के YouTube syndrome क्या है? YouTube में, Google में देखे तो वही लीजन मुझे है बोल के टेंशन है, राइट? हाँ. So 2 days back, midnight 1 o'clock, in a great panic, one of my friend sent an image. Please see my 11-year-old son Ray. My son is having, he's my schoolmate, that guy is software engineer. He is having a white patch on the nose. What is he suffering from? Ray बोल के बोला. So after taking history on telephone only, it shows that it is pityriasis alba. तो मैंने बोला don't worry रे, pityriasis alba, nothing to do. But anyway, one of my classmate, Dr. Sunita Reddy, is a dermatologist. So उसको एक बार दिखाओ रे, she will also say the same बोला. Then after 2 days, suddenly I remembered, and when I asked him, he said, "Hey, उसके लिए dermatologist को पास जाके उनको 500 रुपीस क्यों देना रे? मैं पूरा Google में देखा, pityriasis alba बोल के सब लोग बोल रहे, कुछ भी नहीं करना, जरा moisturizer लगा रहा हूँ मैं बोल के बोला." So Google has become the doctor. Dermatologist became unemployed with MD. So hypochondrosis. Sometimes people unnecessarily suffer a lot. So doctor, a 6-year-old, no interest in daily activity. He is not engaging with other children. What is he likely suffering from? Come on, 281. Who is going to give the correct answer? Sunil बोल रहे ADHD, प्रमोद, निहारिका, अनीशा चौधरी, सब लोग बोल रहे ऑटिज्म. मैं भी सोचा ऑटिज्म, but this cannot be autism only for one reason. What is the typical age of onset of autism, doctor? Favorite question of the examiner. Typically less than 3 years. Less than 3 years should be there to call it as autism. So autism, ADHD, Asperger are very close. ADHD is spotted in school. They have a normal IQ. Pragmatic language problems. High comorbidity with other problems, often mistaken for bad behavior. Actually, this is not even fitting into that. Classic autism, IQ is lower. They often fail to develop spoken language. Problem with non-verbal communication. But only problem is age. Right? So, Asperger क्या होता है? Asperger syndrome, it has a later onset, high range of IQ, Einstein, no language deficit. Non-verbal communication is less severe, but motor skills are very clumsy. फिजियोलॉजी में डिस्टिंक्शन आता है, इसको एनाटॉमी में फेल हो गया डिसेक्शन करने में. सो दैट इज एस्पर्जर. सो व्हाट इज द प्रॉब्लम फॉर अस टू कंसिडर ऑटिज्म? रिमेंबर, apparent age before 3. So once more let me tell you, psychiatry में, pediatrics में, autistic disorder, ADHD, एक मर्तबे कितना देर लगता है? 10-15 मिनट से ज्यादा नहीं लगता. So doctor, those who have not yet taken, please call our helpline 9000-868-356. You will get the PDF of the high-yield topics. You will also get 3-day free pass to the entire onlinembbs.com video library, and you also get included in our WhatsApp study group. So please, these are the 3 things that you should do. You can tell your juniors to do. Now, what are the diagnostic criteria of autism? Reciprocal social interaction nahi rehta. It's like a face-to-face classroom, not a online. Live online bole to reciprocal rehta. Qualitative impairment in communication development, that is social communication. But our live online is better than the real physical face-to-face, because social communication बहुत होता. Restricted, repetitive, stereotyped pattern of behavior, that defines the autism. The symptoms must have an effect on the ability to function. They should start in early childhood. They are all the important DSM-5 criteria. Now, what is the drug of choice for alcohol poisoning, doctor? Already we discussed it now. Fomepizole. अभी बताओ, एक अल्कोहल डिहाइड्रोजनेस है, एक aldehyde dehydrogenase है. Yesterday only I told you. Fomepizole is inhibitor of alcohol or aldehyde dehydrogenase. Which one? Come on. Disulfiram is inhibitor of what? Quickly punch your answer, doctor. Disulfiram is inhibitor of what? Fomepizole is inhibitor of what? Shoot. Anisha Chaudhary, fomepizole is inhibitor of what? Yesterday I told one mnemonic also. Doctor, fomepizole, उसका स्पेलिंग में क्या है? ओ है ना? Fomepizole. O. So alcohol dehydrogenase का inhibitor है. disulfiram ये है. So aldehyde dehydrogenase का inhibitor है sulfiram. Disulfiram is a type of what? Aversion therapy. Aversion. Squeeze technique. Where do we use, doctor? When there is any premature ejaculation. So what happens? The person instructs his sexual partner that I am quickly reaching the ejaculation point and I am getting orgasm. So to stop me from ejaculating and going into orgasm, squeeze the glands. So once the glands is being noxiously squeezed, then the tendency to ejaculate stops. Then he continues the act of intercourse. So that is called the squeeze technique, is what you need to basically remember. It is similar to the mother pinches for bad habits in the childhood. Similar to that is the squeeze technique. Now, doctor, before giving contrast, what do you want to check? Contrast can lead to renal failure. So, renal function test check karo, very important. What is the gold standard to diagnose renal stone, doctor? Gold standard. Helical CT, non-contrast. So, non-contrast CT में आपको मिल जाएगा radio opaque stones can be detected, hence called gold standard. Now what do you see in this image? In this image, you are able to see apple core appearance that got thinned out. That is a sign of colon carcinoma. So like an apple core, there is a constriction of the gut. Then where do you see claw sign? This is called claw sign, right? You are able to see claw, no, doctor, in the barium enema. Typical claw sign in ileocolic and colocolic intussusception. That is what you need to remember. Shanti, Shanti, Shanti. So doctor, thank you all for giving your time. I was just thinking, पूरा साल हम मिलके पढ़ाई किए, आज हम मिलेंगे या नहीं मिलेंगे, फिर भी आप सब आए हैं. Thank you very much. So, what are you born for? You are born to become the top cardiothoracic surgeons, plastic surgeons, cardiologists, neurologists. And is it a rocket science to top the NEETPG? No, no, no. 953 topics, Dr. Murali Bharadwaj, onlineMBBS.com video library. And a bunch of classmates who can work like zombies with only one single goal and one single dream to become the winner on the WhatsApp group of online MBBS. That's the best way to play, enjoy the preparation like a play and become a topper. So with that same goal, with no other biases, don't doubt your heart, don't doubt your mind, don't doubt your capability. Already you are all brilliant. That's how we all become medical students. We did not run away from the medical college in spite of large amount of stress in passing exams, right? So already we are made for it. This is one more step of that. So good luck, and I hope to catch up on one more session in the night with 2018 December, this is the June paper. December FMG pattern questions in the night for a couple of hours to play a lullaby to make you to go to sleep for the tomorrow's game. Good night. See you once more at night 11 p.m. Bye-bye.